Well, thank you for tuning in. As you learn more about our family medicine residency, I wanted to thank Dr. Deb Simon for meeting with me today to discuss the opportunities for learning obstetrical and gynecological procedures in our new family medicine residency. So,
Yeah,
Dr.
thanks for
Simon,
having me.
thank you.
Yeah.
Thank you for joining us. I thought maybe we'd just start if you would share a bit about yourself.
Sure. So I'm a general OBGYN. I've been at Gunderson Health System for about 7.5 years, and I came out of residency, so this is my one and only
Your one and only
job.
Great.
And I am from South Dakota, and I did my medical school in South Dakota. And then I did my residency at the University of Wisconsin in Madison, my OBGYN residency. And then I came here after that, and I've been here the whole time. And so this is my first, and it's the best job, so I'll never leave it.
Good. Well, we're glad because we know how talented you are. Thank you so much.
Thank you.
I thought it might be good for a prospective resident to know what kind of volume you guys have on the labor and delivery suite, those kinds of maybe statistics, just so that they're aware of the opportunities here to learn.
Sure. So our deliveries average about 1,400 to 1,800 a year, and about 4 deliveries a day, although it's variable from day to day.
Yeah.
Our C-section rate here is very low, which we're very proud of, and so we facilitate a lot of people having vaginal deliveries, and we facilitate a lot of VBACs, or vaginal deliveries after cesareans. So it's a great place to have experience doing normal obstetrics. We also have perinatologists here and a level 2 NICU, so we do a lot of high-risk OB, and we have a lot of patients come in from the surrounding communities due to pregnancy complications, and we are able to take care of a very high percentage of those patients and those babies here.
That's awesome.
Yeah, so it's excellent.
So what you're saying is if a resident came here, they'd get bread and butter OB that they would do in their practice, but they'd really get a lot of experience with high-risk stuff.
Absolutely.
Okay. Like what kinds of things come in?
So almost anything that you can think of obstetrically. So all of the normal people who deliver at term, and then the people with preterm labor, pregnancy complications like placenta previa, placenta abruptions, people who are have twins or triplets, multiples, just about any problem you can think of. There are just very, very few problems that we don't handle here.
That you wouldn't handle. You had mentioned a low C-section rate, which means that you really work with people in labor.
Absolutely.
What is your C-section rate?
So it's variable, but it's right around 20%.
Great.
And last month it was 10%, or some ridiculously low number. We have a very higher than average VBAC rate here. I think primarily because of the way we do our call and the way that we are patient and our midwifery group, which would be another opportunity for the residents to work with our midwifery group and see that style of care and increase the amount of deliveries they're exposed to.
That's fantastic. You know, I thought it would be interesting for a prospective resident because generally they're going to follow the obstetrician on call during their shift,
Sure.
depending if they're at PG 1, 2, or 3. What is a 24-hour call day like for you?
Sure. So the call days are pretty variable, but they all have some of the same components. So at this point, we switch off around 8 o'clock, so the person who's coming off call signs out to the person who was on call, and at that point we go through what is on the labor board. Everybody's kind of used to that. These are the people in labor. This is what's out there. These are the antepartum or high-risk patients that are on our other unit. This is what's gone on during the night. So the sign-out occurs.
Yeah.
And then as long as everything is quiet and I don't have to immediately see somebody, in labor and delivery, I usually go around and do my postpartum rounds on the people either that I've delivered or my partners have delivered that they won't see that day.
And the residents would help with that?
Yep, absolutely.
Awesome.
Yep, that would be great. And then we manage the patients in labor for the entire shift. And then during the day, I could get calls from the clinic and patients I need to see there that have come in either added on or emergently. I could get called to the emergency department for situations that are either like gynecology consults or for someone with first trimester bleeding who may be having a miscarriage who may need a D&C. We get called to do ultrasounds in the ER, and if an ultrasound, a gynecologic ultrasound, is ordered by another department, those are staffed by us, and so the residents could
okay.
be a part of that.
Awesome.
And then we also get consults from other departments. Say they internal medicine admits somebody for a medical problem, but they have a gynecologic concern, they would call us for that. And then I guess one of the other things I would commonly do on call is get calls from the nurse advisor or from outside physicians, either for advice, consultation, or transfers.
Wonderful.
Yeah.
So, a resident, you could maybe envision even a resident going down to the emergency room, staffing a patient, seeing them, being involved, even to the operating room, then,
Yes.
I suppose.
And that would be excellent because they could see the patient from presentation to work up to surgical, for example, an ectopic
An
pregnancy,
ectopic, yeah.
to surgical resolution. So I think there's a lot of potential for that.
That's awesome.
Yeah.
Great. The other piece I know that you're going to be involved with is the gynecology experience, which will be a month. I think we have set up 2 months in the first year and 2 months in the, 1 month in the first year, 2 weeks in the first year, 2 weeks in the second year. What do you envision for that?
I think that we're going to be very focused on trying to make sure that the residents get a good volume of initially bread and butter, kind of very routine gynecologic things, abnormal uterine bleeding, contraceptive management, pelvic pain, things
Yeah.
that they're going to be seeing in their clinics as family medicine doctors. And then hopefully as they move along and get more advanced, they'll learn how to do things like endometrial biopsies, IUDs, Nexplanons, procedures
Great.
that they can do in their clinics also. And then there's an opportunity, there's an affiliate clinic here in town, a reproductive health clinic, where the residents will be able to go, and that's all bread and butter kind of OBGYN, including procedures that they could do there.
That's awesome. So the long-acting reversible contraceptives and those things that are a
Absolutely.
big part of their practice. That's great.
Yeah.
So I think that sounds like an awesome experience also. What's the level of enthusiasm in your department for this family medicine residency?
I think we're all very excited. We've had the opportunity to work with residents from the other institution in town, and it'll be nice having our own residents that we'll have more continuity with. We'll see them for longer periods of time, be able to see their progression from
Right.
brand new to experienced. And everybody's excited about working with the residents, and we're all trying to make an ideal experience for them so that they'll be able to hopefully go out into their practices and feel very comfortable taking care of patients, OB and GYN in the clinic, and then of course manage them in labor.
So I guess just if a prospective resident doesn't know, you have been teaching family medicine residents from other residency programs, so this won't be new to your department.
That's correct. We've been working with them since I've been here, so all along, and we're used to working with them. And I do think this will even be more ideal because we'll get the opportunity. They won't just come and go, but they'll be here more long term.
That sounds awesome.
Yeah.
Well, it sounds like it's going to be a great experience for the residents who really want to learn these skills. So I really am appreciating all that you've done for the residency program.
Absolutely.
Okay,
Thank you. We're
thanks.
looking forward to it.
Okay, all right.
Thanks.